why is corticobasal implantology not being taught in German, Austrian, and Swiss universities? Well, this is a question of the money. I mean, usually people do what they are being paid for. So, for example, patients pay me to put implants, and then I do it, and I do my best. A professor at the university, it's not so clear from where he gets the money, but it's for sure that he doesn't get only the money from the state or from the university. He gets much more money, of course, from the industry. And the industry then tends to tell what this guy has to tell during his lessons. So basically, the professor, the modern professor, is not researching anything. The modern professor is reading out of the instructions of the medical devices from the companies which pay him for doing this. Unfortunately, this is it at the university, so don't expect too much from these institutions. Especially parents shouldn't expect too much from this institution. They should not expect that their kids learn something. Basically, they are just being trained to use a few products on the market, and that's what the professor is paid for. So corticobasal implants are very cheap and very functional devices. I'm not interested to pay anything to a university to teach this. I mean, I teach it myself outside the university. Prices for implants depend, of course, on the marketing channel. So corticobasal implants are available on mail order. They cost approximately 70 euros, 60, 70, 80 euros per piece. So this is quite affordable. This is what the dentist wants, what the patient wants. But on the other hand, these top brand implants, like this Swiss Nobel brand, which I mentioned in some of the lectures, they cost around 300, 350 euros. So the question is, who gets the money? No, of course, the shareholders of these companies get money, the CEOs get the money, but also the universities get a lot of money. For example, as this third-party funding, which is paid to the university and which is paid, of course, first of all to the professors who are promoting this. Many professors are not only on the payroll of these companies, but they also get commission for every implant which is sold in their area. So this, of course, adds up, and this makes implantology expensive. And of course, these professors will never ever accept that anything else is being sold in their area. And that's why they are so strict about this, and that's why they fight any what they call competition. But in fact, it's not their competition, but simply this is another product on the market, and they simply try to wipe it off the market, and if necessary, they will wipe it off the market, including the doctor which is using this product which they don't want. So this is not fair, but they have a lot of power. This is, of course, not democratic, and very difficult to understand why this happens in democratic countries. But this is the situation. I would call it a mafia situation.